Good morning, class. I wanted to talk to you about the digestive system, which is chapter 20 in your book. If you note, the bowel has been called the second brain in the body because it contains more neurons than the spinal cord. It also secretes neurotransmitters, which you'll learn more about when you study the nervous system, and hormones similar to those of the brain. So the bowel has a lot of unique characteristics to it, and it's very important to our health. The first part talks about the overview of the digestive system, and basically it gives you the different parts of the digestive system. You need to get to know those different parts from the mouth clear to the anus. Know the order of it: mouth, pharynx, the esophagus, which is the tube, to the stomach, and then to the small intestine. And we'll talk about the different parts of the small intestine, large intestine, rectum, and anus. The other parts of the lesson, too, that are important are the accessory organs: the teeth, the tongue, the salivary glands, the liver, the pancreas, and the gallbladder. If you would look at the top of page 424 in your book, it talks about the body at work and the different types of digestion that occurs. Mechanical digestion occurs in the mouth because of chewing. We chew up our food, and that breaks the food down and gets it ready to be swallowed. But chemical digestion also occurs because of the salivary glands releasing enzymes, salivary amylase, especially for breaking down the carbohydrates in the food, and also lipase, which also breaks down the fats in the mouth. So just be aware of that. What you do need to know are the different layers, tissue layers of the digestive tract, which are listed there on 424. The mucosa, you already know. That's that innermost layer. It has 3 layers of its own. And basically, the digestive tract is really important. That mucosa lining, it secretes mucus, which you knew about, so things can pass through easily. It also is responsible for producing digestive enzymes, which we'll talk about a little later, and hormones. But it's an absorption site too, so nutrients are absorbed in that digestive tract in order for the body to use it. So you have the mucosa, you have the submucosa, which is connective tissue, and that has the glands, the blood vessels, the lymphs, the muscularis, and the serosa. And just remember what the serosa is under that fast fact there. It is actually that visceral layer of the peritoneum that you learned about previously in A&P. It's called the visceral layer because it covers the organs of the abdominal cavity. And the parietal layer is the part that attaches to the peritoneum, the peritoneal wall of the cavity. If you look on page 425, it talks about the peritoneum itself. I remember seeing a news article saying scientists had discovered a new organ in the body, and I was like, what organ are they talking about? And here they were talking about the mesentery does a lot more than what we really understood before. But the mesenteries, this is visceral layers of visceral peritoneum that help keep your digestive organs in the place where they're supposed to be, so everything doesn't just fall down to the bottom of the cavity. Mesenteries have blood vessels, they have nerves, they have lymph vessels and lymph nodes as well, but they hold the organs into the places where they're supposed to be. Know the fast fact there about intraperitoneal and retroperitoneal. And then at the bottom of page 425 talks about the greater and lesser omentum. The greater omentum is kind of like this lacy lattice work of like this fat covering that covers the organs in the abdominal cavity. And basically it helps prevent friction amongst the organs, but it's also good at keeping any infection that would be there more localized so it doesn't spread throughout the whole body. And you can see the greater omentum is attached to the greater curvature of the stomach and kind of hangs down. And then there's a lesser omentum, which extends from the lesser curve of the stomach to the liver. If you're in a C-section later in level 3 and you hear Dr. Brown pull you, if she pulls you up to the table and she'll want you to say what the omentum is, she may even give you a rhyming thing. I heard her one time say, it rhymes with bobentum. So that is your clue to say omentum. And hopefully you will make me proud when you do that. The fast fact there about the peritoneal cavity can also fill with fluid when there's disease present with some of the organs, specifically a disease of the liver that I think of, anybody with hepatitis or cancer of the liver or whatnot, they oftentimes develop this fluid in the abdomen called ascites. So then on page 426, it talks about the mouth. Get to know the different parts of the mouth, the tongue, the lingual papillae, the lingual frenulum, the uvula, soft palate, and hard palate. And then know the salivary glands at the bottom, the parotid gland, the submandibular gland, the sublingual gland. And the body at work there talks about how the saliva moistens and lubricates and protects the teeth, but it's also really important for taste. And one of its main roles, though, is to moisten food and transform it from a mass into what we call a bolus. And the bolus of food is what's transported from the mouth down into the stomach. And remember, I said salivary amylase starts breaking it down with chemical digestion, as well as lipase breaking down some of the fat in the mouth, and then the mechanical part of chewing. The salivary glands secrete about 1 liter of saliva a day, which sounds crazy, but it does. But we need the saliva because it helps stimulate taste in our mouth. Remember, when you smell food or you think about food and how you start to salivate, that is part of the body's response system to help with the digestive system. On page 427, it talks about the teeth, and the process of chewing is called mastication. The adult mouth has 32 permanent teeth, and you can learn what the incisors are, the canines, premolars, and molars. Deciduous teeth are the baby teeth that we develop when we're small, and kiddos start getting those in pretty successive order until about 2.5 years of age, and then around between 6 and 13, they start losing those deciduous teeth and getting permanent teeth. Know the different parts of the tooth at the bottom. What is the crown? The gingiva, which is the gum. The neck of the tooth. The root, which is embedded in the socket of the jawbone. The enamel is the covering of the crown, and the dentin is that firm yellowish tissue. The pulp cavity and the pulp, and all of that. Know that the enamel is the hardest substance in the body, but it can't be regenerated like dentin and cementum can be with the tooth. So be aware of that. So you want to maintain the enamel of your teeth. On page 428, it talks about the pharynx and how after food's been broken down by the teeth, it's moistened by the saliva. The tongue manipulates that bolus back to the back of the oral cavity. And then the soft palate lifts, closing off the nasopharynx. And that allows the larynx to rise, and the epiglottis is forced over the entrance of the trachea to help prevent us from aspirating. So important things happen in that part of the digestive system. Then know the esophagus, which is the muscular tube that's 10 inches long between the pharynx and the stomach. The one thing you do definitely need to know about is that lower esophageal sphincter. If that sphincter doesn't stay closed after we eat, You can have regurgitation back up, a condition called GERD. One thing that we can do is give medications to help with that, sit up after eating, um, and also, if worse comes to worse, sometimes they do a surgery called a fundoplication, which they'll wrap the top part of the stomach, which we're going to learn about next, around that lower esophageal sphincter to keep that closed a little bit better. But know what that is. The lower esophageal sphincter, it's also called the cardiac sphincter because that is the area of the stomach where it's called the cardia. So if you look on page 429, you'll see where the cardia is, and then you'll see the fundus is the top part of the stomach. A lot of organs where the top part is the fundus. The uterus has that too. But the stomach also has this top part of the fundus. And remember I said that surgery, that fundoplication, they take that top part and wrap it around. Then you have the body of the stomach. You have the pylorus with the pyloric sphincter. And that's the sphincter that allows the food to move from the stomach into the small intestine. No, your stomach on page 429. Just a little hint there for you. And also know that once that bolus of food hits the stomach and starts mixing with the gastrointestinal secretions, we call it chyme at that point. And you can see the body at work. It talks about enzymes in the stomach partially digest protein, as well as small amounts of starch and fat. Most of the digestion process and the absorption of nutrients takes place in the intestine. People think it takes place in the stomach, but it's mainly in the intestine. Alcohol is also absorbed mostly in the small intestine. However, the rate at which alcohol is absorbed depends on how quickly the stomach empties its contents into the intestine, which is why eating before consuming alcohol slows the effect of alcohol, which is kind of good to tell people. And there's a little cross section of the stomach as well. On page 430, it talks about the gastric mucosa and having some depressions called pits and several different glands, gastric glands, open at the bottom of each pit, and they secrete the various components of the juice, the gastric juice. Our bodies make up to 3 liters of gastric juice each day. So get to know what each of those different cells do. The mucus cells, of course, secrete mucus, lining the mucosal lining. Parietal cells secrete hydrochloric acid, an intrinsic factor, and that helps to kill a lot of the different microbes in the swallowed food. The chief cells secrete digestive enzymes such as pepsinogen, which we'll talk about. And then the enteroendocrine cells secrete ghrelin, which stimulates the hypothalamus in the brain to increase our appetite. Fast fact there, read over that. And then also look at the body at work at the bottom about how the different signals that occur for the stomach to empty. So swallowing signals the stomach to relax and allows food to enter. Once the food is entered, the stomach works, mixes the food, and then propels it towards the first part of the small intestine, which is called the duodenum. So no, peristalsis is partially responsible for the strong contractions that help break down the food. And then it talks about chyme moving towards that sphincter and is propelled by those peristaltic contractions. I think page 431 is really important as well because it also talks about how our appetite works and the stimulation of our gastric secretions that occur. So the cephalic phase of digestion occurs with the mere thought of food. I mentioned that before. The sight, the smell, the taste, and the thought of food creates these impulses that are sent to the brainstem, and our nervous system then signals the stomach to start secreting gastric juice as well as gastrin. Gastrin stimulates gastric secretion even more, and this is called the cephalic phase, because the brain is kind of telling the gastrin to do that. The next phase is the gastric phase, and that is when food enters the stomach. And when we have the stretching of the stomach, that triggers nerve reflexes to increase the production of gastric juice and gastrin. So, gastric phase, and you think of gastric referring to stomach, it's pretty easy to remember that that's the second phase. And then the last phase is the intestinal phase, when the chyme, that food that was a bolus, and then when it went to the stomach became chyme, and when that chyme moves into the duodenum triggers nerve impulses and hormones, and those tell the stomach, hey, I'm taking over now. I don't need you to keep secreting gastric secretions anymore, so you can slow down the production of that. So that's how that works. Life lesson: peptic ulcer is at the bottom there. Know that H. pylori is a bacteria that's really a lot of times responsible for peptic ulcers. And then also the body at work. Vomiting results from a variety of stimulus. You have overstretching of the stomach, chemical irritants such as alcohol, toxins, pain or fear can induce vomiting. And so know what happens with vomiting, and it kind of explains the whole process. Kind of interesting. The next sections are on the liver, the gallbladder, and the pancreas. Know the different lobes of the liver, the falciform ligament, which is what separates the left and the right lobes. Know what hepatitis is. That's swelling and inflammation of the liver. And then at the bottom there, you see the back side of the liver, and you can see the caudate lobe and the quadrate lobe, which is next to the gallbladder. So get to know the different parts of the liver there. I'm not going to ask you a lot about the blood flow in throughout the liver. You do need to understand it and understand what the portal vein does and the hepatic artery. But I'm not going to get real specific with that. Make sure you read it over and have a good understanding, but I'm not going to make you memorize it. The gallbladder on page 434 is basically a storage tank for bile. And just know bile comes from where it comes from, and then it's stored in the stored in the gallbladder. Bile reaches the gallbladder through a series of ducts, and it comes from the liver, and it goes through the right and left hepatic ducts, and those ducts converge to form the common hepatic duct. And when it goes on to become the common bile duct, and then bile from the liver first fills the common bile duct before backing up into the gallbladder through the cystic duct. So it fills that whole duct up, and then if there's extra, it goes back in the gallbladder, that storage tank. That's why you can still have adequate digestion and not have a gallbladder, because the bile will still keep coming through that duct system. You just don't have the backup storage tank. No, the body at work, the liver secretes up to 1 liter of bile a day, and the main bile pigment is bilirubin, and we look at that specifically when babies are born. We'll talk more about that in level 3 with bilirubin levels. And formed in the liver from cholesterol, bile salts aid in the digestion and absorption of fat in the small intestine. 80% of bile salts are reabsorbed in the final section of the small intestine and then returned. Oftentimes you can get gallstones in the gallbladder as well, and that's often because of excessive cholesterol in the bile. Sometimes you don't have any signs and symptoms, and then sometimes it can clog a duct, and that's when you have severe pain. The pancreas there is on page 435. It lies behind the stomach, right at the curve of the duodenum. And it gives you all the different parts of the stomach there as well. One thing I do want you to know is the vagus nerves and the hormones of cholecystokinin, gastrin, and secretin stimulate bile and pancreatic juice, which helps with digestion. So, if you look at the bottom of 435, the body at work, it talks about cholecystokinin. It says when chyme comes into the duodenum, it stimulates the duodenum to secrete a hormone called cholecystokinin. That causes the gallbladder to contract, forcing bile into the bile duct and the release of pancreatic enzymes. And then at the same time, the hepatic pancreatic sphincter relaxes, which allows bile and pancreatic juice to enter the duodenum. So those hormones and those juices help to break down the food even further in the duodenum and allow for absorption of nutrients. Gastrin is talked about there too. That's the hormone from the stomach and the duodenum, trigger both gallbladder contractions as well and pancreatic enzyme secretion. We'll talk about those pancreatic enzymes coming up. So it helps with contraction, but it's not as powerful as the cholecystokinin. And then secretin is an acid in the chyme that also triggers the duodenum. Excuse me. An acid in the chyme triggers the duodenum to release secretin, and that causes the bile and pancreatic ducts to release bicarbonate, which helps to neutralize the acid content of the gastric secretions as they enter the duodenum. Because you remember your stomach is pretty acidic, and so that bicarbonate is going to help with that acid-base balance in the. So secretin helps with that, the bicarbonate. So the next part talks about the small intestine, the duodenum, the jejunum, and the ileum. Get to know the different parts of that. The first 10 inches of the duodenum, the next 8 feet are the jejunum, and then the ileum is the last 12 feet. The fast fact there, the small intestine refers to diameter, not length. The small intestine is much longer than the large intestine. The small intestine is about 20 feet long, whereas the large intestine is about 5 feet long. But it's just the diameter is much smaller. And then the body at work there talks about contractions in the small intestine help break down food particles, mix those digestive juices, and bring digestive food into contact with the mucosal lining for absorption. And it talks about segmentation in the bile with that peristalsis, that muscular contraction helps pushes that chyme further on down the track. On page 437, it gives you an idea of the layers of the intestine again, and then also look at the villi. Remember the villi, increased surface area. We learned that previously, and that helps with the absorption of nutrients. And the lacteals there, they're at the core of each villus. The lacteals are really important for fat absorption. Okay. So the fast fact there, most nutrients pass through the bloodstream, through capillaries, and then travel to the liver. Most fat, however, is absorbed by the lacteal. There's a nice discussion about the gut microbiota at the bottom of page 437, so read over that. But then I want you to look at 438 and 439. It talks about chemical digestion and absorption. And this is something that's really hard for students to understand. So if you just follow the arrows, it will show you exactly what has happened and when it is happening. So you have salivary amylase and also lipase. It helps break down the food, and then once the food is swallowed, it's a bolus that as it's going down, and once it's in the stomach, it becomes chyme. And stomach acid activates salivary amylase. The resultant chyme reaches the small intestine and mixes with pancreatic amylase, and the process of starch digestion resumes. And then it talks about how the different final stages of the carbohydrate digestion. So that is how the carbohydrates are digested. On page 439, it talks about how the proteins are just digested. In the stomach, the enzyme pepsin hydrolyzes with the peptide bonds and with certain amino acids, and then as the chyme enters the duodenum, pepsin is inactivated, and at that point you have trypsin and chymotrypsin break down the protein even more, and then you can see what happens with the rest of protein digestion. And then fat digestion, it begins in the mouth with the secretion of that lipase, like I told you. But most fat digestion occurs in the small intestine. It doesn't dissolve in water. So as it enters the duodenum, it's kind of like this congealed mass. And so fat must be broken down into small droplets, we call emulsification. And it gives a nice discussion of what happens with fat digestion and pancreatic lipase helping with that. And then last but not least, on page 440 is the large intestine, the different parts of the large intestine. Get to know that, know what appendicitis is. There's another discussion of the human microbiome on page 441, and haustral contractions, the body at work on 441, and mass movements. And the process of having a bowel movement is called defecation. Note the life lesson with the changes in aging and what happens as we age and with the digestive system as well. There is also a big list of digestive gastrointestinal medications that I have on Moodle. A lot of them you're familiar with. They are maybe over-the-counter medications, but get to know those different types of medications as well, because they will be very helpful for you as you venture into the next level. Look over your key terms, do your questions at the end of the chapter and your study guide, and work on your workbook. And I will talk to you this week. Thank you.